Hi, my name's Louise Frampton from Clinical Services Journal, and I'm reporting live from IDSc today. With me I have Judith Pilling. If I can ask you just to introduce yourself and tell everyone a little bit about yourself.
So, Judith Pilling, I'm a qualified sonographer, worked both within the NHS, private sector and also out in industry as well. Currently we've got a new company called i3 Medical, and we have the sole distribution rights in the UK for the new Lumicare one high-level disinfection device.
So, how has the decontamination sector changed during the time that you've been working in this area?
I've been working in this area, certainly the ultrasound field, for a good number of years, and I think what's changed is we used to, and I say the old days, before in the early 90s, 2000, we literally had an ultrasound probe, scanned a patient, took the gel off, put it on the system, ready for the next patient. We didn't really do any specific sort of like cleaning other than with a wipe system, and it could be anything that we wiped it down. Obviously manufacturers weren't happy with those things because it might damage the probe, and so more care is now sort of like taken in that field. And plus also BMIS have introduced guidelines, certainly within the England market, to say that semi-critical devices and critical devices should go through high-level disinfection, some even sterilisation. But certainly when you're looking at endocavity probes for transvaginal scanning and transrectal scanning, or even line insertions, those should go through a high-level disinfection, whether it be a wipe system, which is manual, or moving now towards the automated system.
So why is it so important? I mean, what are some of the sort of risks involved?
It's just basically cross-contamination between patients and infection risk, the likes of, particularly for sort of like transvaginal scanning, HPV, bacteria and things like that you want to sort of like reduce. I don't think you're ever going to eliminate them, but you can reduce them to a level. And certainly, been talking to people here at the show, and they were saying, you might have 5 million bugs on a probe. If you can reduce it to only 5, you've minimised that risk, and that's the whole intention. You want to minimise the risk to the minimum you possibly can through high-level disinfection.
So what are some of the benefits of moving from a manual system to an automated system, do you think?
So there are various sort of like wipe systems out there that you can use. They do involve obviously a wipe that you've got to dispose of. You've got to change gloves between each stage, which again, you've got to dispose of those products as well. And it's the time, and are people actually doing it to that level? It should say that actually stage 1 should take, say, 30 seconds, well, quick wipe. Actually, you should still be timing it. You're not disinfecting if you're not following a procedure. And we all want to cut corners, that's human nature. We all cut corners where possible, where if you can automate it, you've taken it out of that operator dependability more than anything.
So obviously there's a patient safety angle there, but what about in terms of sustainability?
Sustainability, again, we're back to how do you do a high-level disinfection? Yes, there's a wipe system, which again, they'll always want to reduce cost to find products that are low cost and also perhaps biodegradable, or and that actually sort of like doesn't affect the planet. You can move to an automated system, but then you've got the chemicals, or you've got UV light that uses mercury bulbs, and again you've got to dispose of them. And that's probably where our product came into the market. It was great to have an automation because you remove the operator error. It was great to have a device that uses UV, but we moved from UV mercury tubes to LED, so power consumption was so much better with the LEDs. And also moving away from the chemicals, we've got no chemical disposables either. So we wanted to produce a product that had the best of all worlds, but also that sustainability. And the product is made that 70% of the product is recyclable as well at the end of life, and we can produce more things. We could probably think that it will go on longer than 5 years, but we're saying 5 years at the moment. It's technology will change.
With the NHS net zero target, obviously this is going to become increasingly important, isn't it?
Very much so. Very, very much so. And that's basically what we want to look at. We want to look at the carbon footprint per cycle and perhaps compare it to others, because obviously we've got to show that there is a benefit to our product over what's out there as well.
So what are some of the considerations that trusts need to think about when they're introducing automated systems? What advice can you give?
We've got to look at the workflow of the department, because it could be that they don't have to have a machine in every room, they could have a shared machine. We've got to sort of like look at the workflow that ultrasound. Everybody needs most people that go into hospital will have an ultrasound scan. It used to be everybody got a chest x-ray, now everybody gets an ultrasound scan, a chest x-ray, etc. And it is a numbers game. We've got to be able to reprocess those probes in sufficient time to not cause any backlog. So again, we've got to look at the cycle time of how we can reprocess that, and at 90 seconds, that is pretty much achievable. So we don't stop that workflow of patient going through.
Is there any advice that you can give people who are looking to build a business case to the board to implement this kind of technology? What advice would you give them?
I think what we've got to do is, I don't think automation is right for everybody, because the machine needs to be sort of like more static based, whereas if you're scanning out in the community where you're in a clinic in the morning and then another clinic in the afternoon that are 10 miles apart, it's not feasible probably for you to carry that machine with you along with your ultrasound transducers and your ultrasound machine. If it's a unit which is static, you've got to look at the numbers. How many numbers are you doing? If you're doing 30 pelvic scans or 10 pelvic scans a day or even 5 pelvic scans a day, then look at your costs of what you're currently using, and is my device going to make it more cost effective, more sustainable, a lower carbon footprint? There's all those factors to consider. It's not just a simple question of moving from one to the other. It might not be right for you, but it also might be right for you.
Excellent. Some really useful advice there, some really interesting points. So thank you so much for giving up your time, Judith.
Thank you very much.
Bye.